Let's talk about Hillary's health.
Ladies and gentlemen, welcome to In.The.News. Live news and commentary from around the world by your host, Holy Joe Rock and Roll.
What up, everybody? It's Holy Joe Rock and Roll coming at you live and unscripted. This is In the News, September the 6th, 2016. Let's talk about Hillary's health. A lot of people are talking about Hillary's health. Now, it started in 2012 when she fell down and had a concussion in her brain. She was on blood thinners. She was wearing Fresnel lenses so that she could help see during the Benghazi hearings. We know that she is almost 70 years old. She's a grandma. Doesn't matter. Know plenty of healthy grandmas. But the coughing fits. At first I thought, look, maybe she has bronchitis or an upper respiratory infection. But if you simply go to Wikipedia, you don't have to be a doctor, although I went to medical school. And here's what you can read in Wikipedia for coughing. Frequent coughing usually indicates the presence of a disease. This has been going on for months, people. For months. Over 6 months. Many viruses and bacteria benefit evolutionarily by causing the host to cough, which helps spread the disease to new hosts. Most of the time, irregular coughing is caused by a respiratory tract infection, but can also be triggered by choking, smoking, air pollution, asthma, gastroesophageal reflux disease, postnasal drip, chronic bronchitis, lung tumors, heart failure, and medications such as ACE inhibitors. Now, what are ACE inhibitors? ACE inhibitors, it's a pharmaceutical drug, angiotensin converting enzyme inhibitor, used primarily for the treatment of hypertension, which is elevated blood pressure, high blood pressure, and congestive heart failure. Okay? This group of drugs causes relaxation of blood vessels as well as decreased blood volume, which leads to lower blood pressure and decreased oxygen demand from the heart. Okay? So, is Hillary Clinton taking ACE inhibitors? We know that she's taking blood thinners. Maybe she's taking ACE inhibitors as well to help her with a bad heart. I mean, there's a lot of questions that have to be asked. Now, truthfully, you can't really know a patient unless you do physical examination, do some tests. Now, her official doctor, Hillary Clinton's official doctor, has said that she's in I don't want to put quotes around it, but in excellent health, and she's in excellent health. Okay? But, pretty much any doctor will say that if you're paying them. Pretty much, okay? We probably would have to have an independent panel of doctors review her medical records to know for sure. Now, compare Hillary Clinton's behavior over the last 6-7 months to that of Donald Trump. Donald Trump is maybe a year older. He's 70 years old. He appears to be in very excellent health. He's doing speeches 3-4 a day. Even on Memorial Day weekend, he was doing speeches. Memorial Day? Yeah, this past weekend. Labor Day, whatever this weekend is. I'm out of the country, so we're not celebrating that particular holiday. So he's been doing speeches 3-4 a day, traveling all over the place. Imagine if he had any kind of coughing fits. Think about what the media and the left was demanding of John McCain. He was 69 years old or 68 years old when he was running for president in 2008. And they demanded his medical records simply because he had some skin cancer or melanoma basically on his butt cheek in the past. And they wanted to know if he was healthy. And he provided that information to a group of physicians who reviewed the information and said that he was in good health, he was good to go. Now, why aren't we asking that from Hillary, who is exhibiting serious, questionable behaviors. I mean, these coughing fits. Now, I thought at first, look, maybe she has bronchitis, or maybe she has just an upper respiratory infection, which she may have. But if it's been going on for months and months and months, that may indicate a compromised immune system, which is not healing the body. The body's not healing. And that's not a good sign. That's not a good thing. So to request, and in all fairness, we could request both candidates reveal some kind of recent, diagnostics of their health. Maybe, it doesn't necessarily have to be public, but it should maybe go to a nonpartisan review board of several physicians who would sit down in a room, confidentially review all the information and come up with an analysis, right, of health. So treatment for Hillary would be to stop smoking, discontinue ACE inhibitors, cough suppression such as codeine and dextromethorphan are frequently prescribed, but have demonstrated to have little effect. Other treatment options may target airway inflammation or may promote mucus expectoration, which means the release of mucus. As it is a natural protective reflex, suppressing the cough reflex may have damaging effects, especially if the cough is productive. Now, productive means that when you cough, phlegm comes up. Now, we don't see phlegm coming up, we just see it with basically a dry cough, which sounds like this. Right? That's what we're hearing. That's what we're hearing over and over again. And it's a problem that has to be considered serious, because the fact that the media and the Hillary campaign continue to cover it up makes me wonder what's really going on. Hillary's health, hashtag Hillary's health. Get it out there, let people know. It's another thing to be concerned about in this 2016 election cycle. Thanks for watching, and remember, make it happen for the captain, because you're the captain.
Thank you for watching In the News, a feature of HJRR TV and presented by the Reverend Dr. Holy Joe Rock and Roll. Please rate us, follow us on Twitter, and subscribe to this channel for more In the News.